Hello, everyone. We have been talking about every week various different areas of exceptionality. This week, we're going to be talking about behavioral disorders. So let me go ahead and share my screen. So we're talking about behavioral disorders. Before I start talking about behavioral disorders as a category of exceptionality, I just want to talk about behavior in general and why behaviors that are considered problematic might occur. Um, so knowledge gaps can be a reason why behavior that challenges the norms might occur. So what happens when a student doesn't know what is expected of them or hasn't had enough knowledge and practice in a particular skill or concept? Um, Children and students will react differently in those kinds of situations. They may externalize by doing some verbal or some physical types of things, or they may just internalize by shutting down, disengaging, sleeping, etc. Communication is an area that, in particular, for children with more significant disabilities, such as significant intellectual disabilities, many children with autism who do not have a consistent means of communication, their behavior becomes their means of communication. And so students who are um, not able to communicate via words or sign often communicate their needs for, or, around frustration, around need for help, around boredom, physical discomfort through different behaviors. And we'll talk a little bit more about that when we talk about autism next week. Sensory or perceptual needs um, can result in specific kinds of behaviors that challenge the norms. So you may have students who have sensory defensiveness, like certain noises might be painful. They might be bothered by certain sounds that you and I can't hear or perceive. They may need more or less sensory input. And when we talk about sensory, I'm talking about through senses like touch, sight, um, smell, hearing, if those sensory areas are available to them. And so some of these behaviors that might show up might look repetitive, stereotypic, they may even be self-injuring. So keep in mind that there's always a need that's being met by the behavior. It's not necessarily somebody is acting a certain way to upset somebody or to do something to somebody, but there's some kind of a need that's being met through a behavior. So last week or week before last, we talked about attention deficit disorder. For those with the hyperactivity form might physically need to move, and that physical need to move might come out in ways that tapping, you know, uh, doing things with their hands, doing things with their voices, and that might look like disruptive, like they're trying to be non-compliant or whatever. Um, and that might not necessarily actually be the case. It's just addressing a specific physical need that they have. So the issue around behavioral disorders is the behaviors that are being seen, are being observed, are viewed to be violating norms for classroom conduct, for conduct in relationships. Um, and so some of the behaviors that you typically see that show up as being problematic when someone is getting referred for evaluation for a behavioral disorder might be excessive activity. This kid is aggressive, they're non-compliant, they have anxiety, um, other students don't like them, they're socially deviant, okay? So lots of different types of ways that children's behaviors are characterized. So when we look at different types of emotional behavioral disorders, under the Individuals with Disabilities Education Act and also under the Diagnostic Manual, Statistic Manual for that psychologists use, this is really another umbrella category, a really big umbrella category that includes a lot of different types of mental and behavioral disorders. So we have under this category, we have anxiety disorders, we have, and anxiety disorder is another umbrella term as well too, because you can have under anxiety disorder, you can have specific phobias, PTSD, social anxiety disorder, generalized anxiety disorder, obsessive compulsive disorder. All of that can be under this sub umbrella of anxiety disorders. You have other areas such as psychotic disorders, which is another umbrella term that includes terms that are like schizophrenia, basically severe mental disorders that cause abnormal thinking and perceptions. And then we also have conduct disorder, which is like a group of behaviors that are specifically aligned with difficulty following rules and behaving in what's expected in a social context. Eating disorders is another thing that's embedded under the emotional behavioral disorders. So the Individuals with Disabilities Education Act terms behavioral disorders as emotional disturbance. And it's basically in order for a person to be identified as having an emotional disturbance is they have to have a systematic inability to learn that can't be explained by other factors. They have to have difficulty maintaining or building relationships with peers and adults. Inappropriate types of behaviors or feelings under normal circumstances. So that's some loaded language there. And just they could have a generalized sense of depression or unhappiness, and then also developing some physical symptoms related to their emotional problems. This definition does include schizophrenia, but it doesn't include students who are considered socially maladjusted. So specific characteristics that you would expect to see would be hyperactivity, aggression, self-injurious behaviors, withdrawal, immaturity, and learning difficulties as a result of all of these types of behavioral issues. You can see that there's some overlap with hyperactivity and attention deficit disorder, attention deficit hyperactivity disorder. So the differential diagnosis, the ability to be able to say that what I'm seeing is this particular disorder versus that, and also given the subjectivity and the way things are identified, is an ongoing issue. Okay, so when we talk about eligibility criteria, so you have the diagnostic process, and then you have, so even though someone might be actually diagnosed with a particular disorder, that disorder has to show up in a way that makes them eligible for specific special education services. So having a diagnosis is not sufficient. You have to also show up as requiring a specific need for services. And so when you're being diagnosed, you can't have other areas that are related to your behavior. So it can't be related to a learning problem. And because you have learning difficulties or a learning disability, you start acting out in a specific way. So the primary concern has to be a behavioral concern. The behavior has to significantly depart from age-appropriate and culturally acceptable norms, and this is language that's in the eligibility criteria through the Wisconsin Department of Public Instruction. The behavior has to impact the child and or those around him in their social environment, and it's got to be severe, meaning it hampers their normal functioning to a significant degree, or that their behavior is a threat to themselves or others. It's got to consistently impact their academic progress um, and their social relationships. It can't be episodic, it's got to be chronic. So it's got to be behavior that shows up in over a period of time, and that it's not kind of tied to a situational thing like the child's, one of the child's caregivers or parents passed away and then they started acting out. So it can't be a situational thing. It has to be something that's chronic, that's happening over a long period of time. Um, and it's got to be frequent in terms of the predictability of the behavior happening in various environments. And it also has to happen across multiple settings. So if you're only seeing specific behavior problems in one classroom with one teacher and not in any other setting in school or in home or in the community, then that would be not considered frequent enough. So another thing I want to say about this, when the evaluation process is happening, there are specific questions related to, what is their current status in terms of social emotional development? What are the factors, what characteristics can be seen in the classroom environment? Are there some systematic environmental things that might be, impacting students' behaviors? What is their current status in terms of how they perceive themselves or their self-concept, and how accepted they are by their peers? And then what are their current interests and attitudes towards school and learning? So those are things that need to be considered. And so a person who is diagnosed with emotional disturbance or emotional behavioral disability may have externalizing behavior, which looks like quote unquote disruption, aggression, non-compliance, or they might have internalizing behaviors, which might be characterized as, again, quote unquote, poor self-esteem, suffering from depression, experiencing a loss of interests in social, academic, and other life activities. Might be showing up as substance abuse or self-injury, other types of things. So this is a very complex area, very subjective and undefined means of identifying it. So I wanted to bring back the, if you recall, several sessions ago, we had a brainstorming around different ideas and stereotypes about different types of individuals. And so we had categories aligned with different areas of exceptionality. And then we also had categories aligned with different racial categories or cultural categories or other characteristics. And so I want us to come back to thinking about the intersecting of various different identities. And so I'm going to show you the next 3 slides I'm going to show you are slides that summarize the stereotypes that we all brainstormed, but I put 2 identities next to each other. And so I want you to read through. Okay, so we 2 of the categories that we brainstormed about was Mexican and attention deficit hyperactivity disorder. Okay, and so I want you to look at the stereotypes that we all actually came up with around what people think of people who identify as Mexican. Okay, and then characteristics of people who have ADHD. Okay, so looking at those 2, I'll leave the slide up for a few seconds. Okay, the next slide of colliding identities that I wanted to show you is stereotypes that came up with Black, people who identify as Black, and then also stereotypes that we generated about behavior disorder. Okay, just I'm going to leave that slide up for a few seconds for you to review.